it's funny, you'll see things written all the time about recovery times and especially hamstring strains. I think I tend to use anything between up to 3 weeks for a grade 1. I'd say anything between 2 and 8 weeks for a grade 2, which is obviously a moderate strain, and you're looking at pretty much 12 weeks for a grade 3. So I think, and it can be anything within that. I've had people that have come back from hamstring strains within probably a grade 2 is probably 3.5 weeks, 3 weeks, and I've also had players that take 8 weeks to recover from a hamstring strain. And then if you look at the grade 1s, some of them can only take a couple of days, and then others will just take a little bit longer. So it varies considerably, amongst the population. It depends how long and there's a lot of things that can influence it. But I do say I think those initial stages and that initial stage of treatment right can have a large influence on the rehab time that you're looking at. I think it's important that they carry on doing continued maintenance work, and that's where I would bring strength in. That's where you want to strengthen, but you strengthen both hamstrings together and you get them so the right equals the left all the time, and you get the symmetry. And so that's when I would really bring in a program in terms of strengthening wise. So they would carry on and carry on and carry on, and I think it's really important. It's very easy sometimes when you go back to playing sport and you think, that's it, I don't need to do any more, I can, the injury's over. But it's well known that it takes up to 12, if not more than that, months for a scar to be remodeled and to actually work exactly like it used to in the past. And it's never going to be the same. And I think that's one thing to get across as well. If you get a severe, or what I would call like a moderate hamstring strain, that's never going to be exactly the same as it was before. It's going to act like it, but it's never going to be the same. So it's quite important that you keep educating that scar and putting different stresses through it for months and months and maybe even years afterwards. And I think it's a good habit to get into that. If you get an injury, you work and continue to work that muscle afterwards. Especially in the hamstring, we would use Nordic curls as a continuum for maintenance, and building that and building that and building that, because that's the exercise that tends to have the most evidence when it comes to hamstring injuries, as both in injury prevention and also post-injury. So I think it's quite important that exercise is one of the things I would carry on. Now obviously when you're back into training of any sort, you can't carry on at the same intensity that you're carrying on during the rehab side of things. So what you do have to do is monitor and adjust your levels so that you're giving the athlete or the player enough strengthening work to do, so they carry on and they keep getting stronger and stronger, but we're not overloading them, because then you're going to go back to where you were at the start and they're going to get the injury from the start again. So I think that's quite important, but I definitely think you have to have a post-injury program, and I think that's quite important. And as I say, I think that's often forgotten when people do go back to playing sport again.